America is in the midst of an ongoing opioid epidemic affecting families across the country. An International Overdose Awareness Day is fast approaching, and here joining me live from Philadelphia is Dr. William Morrone and David Hume to talk about opioid overdose, addiction recovery, and how you can possibly help save the life of a loved one. Good morning. Thank you for joining me today.
Thank you for having us.
Tiffany.
Now, first, Dr. Morrone, why has there been such an increase in deaths caused by opioid-related overdose in our society?
The increases can be directly traced back to an attempt by providers to help people with chronic pain with their choices to write prescriptions for opioid pain medicine. Those increased numbers of prescriptions have been paralleled by an increased number of people misusing and abusing their medication. And in the last 3 years, we see more people transfer from the misuse and abuse of pain medicine into using heroin. That's unpredictable because today's heroin is being laced with fentanyl and fentanyl family products that make it very unpredictable. And when somebody uses heroin, there's fentanyl in it, and they overdose, you have 3 to 6 minutes to get them medical help. So it's outside of the hospital model. You can't bring people to the ER to treat this. We need treatment in the home because 54 to 56% of our overdose deaths are in the home. And people at risk should have like a naloxone family product. This is one of the inhalers that does the medicine up the nose. It sprays the medicine up the nose one time for reversal by a spouse, by a parent, and people at risk need to have this kind of medicine in their house.
Oh, wow, absolutely. Now, can you share with us where do states rank or areas rank in the U.S. in terms of opioid-related overdoses, and how can we help slow this public health crisis?
Well, if you break the public health crisis down into the first thing you need to do is stop people from dying. That's it. Ohio is the #1 ranked state for opioid overdose deaths. In 2014, you've had about 2,100, and in 2015, there's over 3,000 overdoses. But Ohio has an order, a standing order that came through the legislature that makes medicine like this available to stop the death and obtain it from the pharmacy. David.
Oh, wow. Now, David, you have a very personal firsthand experience. Can you share that with us?
Yes, this is a photograph of my son Greg, and unfortunately I lost him to the disease of addiction in May 2012. He accidentally lost his life due to a heroin overdose, and Greg was just a great kid. He was an AP student, he was a good athlete, and he did what a lot of young people are wired to do. He experimented with illegal drugs, and it took him up the chain till eventually he used heroin, and he became addicted to it. And after several years of his addiction, he decided this wasn't the life he wanted to live, and he chose to become sober. He had spent 17 months in sobriety. Unfortunately, part of the disease of addiction is relapse. And one night he was out with some friends, and when he was out with those friends, he ran into some of his old running mates, and he decided he could do this one more time, and that was a decision that proved to be fatal. He went with those people, he overdosed, and they didn't know what to do. They lifted him up, they put him in his car, they drove him to a local hospital. They parked the car in the lot there, and they just left him. They didn't honk the horn, they didn't ring the doorbell of the emergency ward, they didn't leave the scene and call 911 and tell people to look in the lot. By the time he was discovered an hour later, it was too late, he had died. 2 days later, in the aftermath of his death, I spoke with the investigating detective, and he said to me, if we had a 911 Good Samaritan law or a Narcan law, your son might very well be alive today. So in order to keep his memory alive, I decided to advocate to make sure parents and loved ones would have the tool that I didn't have, that they had naloxone, so that if they did have a loved one, they could administer it quickly. As Dr. Morrone said, Many of the overdoses, 55% or so, occur in the home. Minutes matter, so you have to get the people administered this life-saving medication, and call 911 to make sure they get follow-up proper medical attention.
Yes, absolutely. And thank you so much for sharing your story, and my condolences to you and your family.
Thank you.
And lastly, Doctor, where can people go for more information about this medication and how to help their loved ones in similar situations?
The most important thing is to learn about the medicine. Go to getnaloxonenow.org and learn how your state, and go talk to your local pharmacist. Appreciates the supply of the medicine, the education, the distribution, and how to use it properly. Getnaloxonenow.org.
Thank you so much for that. And again, for more information, visit getnaloxonenow.org or speak to your local pharmacist or your physician for additional information. Thank you so much. It's been a pleasure speaking with you today.
Thank you for having us.
Have a good day.
Okay.